So we are recording. So guys, welcome back to another episode of this podcast series, and today I have a very special guest with me. Her name is Dr. Rita Singh. She is a gum specialist and she agreed to have an interview with me. So Dr. Rita, welcome to the show.
Thank you, Sudev. It's my pleasure to be on your show.
Oh. So how has your day been?
Oh, very hectic actually. We were supposed to meet at 4, right? And I was like, good, Sudev forgot about the appointment because I was stuck with my case. I was really tired. But now, after the setup and cup of coffee, I'm fresh.
Okay. How was your workout this morning?
Workout in the gym? Oh yes, it was nice.
It was nice?
It was good.
Okay.
That kind of gives me the energy. I feel so fresh after the gym and it just kickstarts my day.
You start your day with an achievement.
Yes.
So, let's start with your first question. So, how long have you been a dentist?
How long I have been a dentist? Well, I finished my master's in 2001, which means I've been practicing for more than 18 years in Kathmandu as a gum specialist. But I joined in 92, so the whole dental experience would be about 28 years.
Oh, that's nice. And why do dentists charge so much?
That's an interesting question. Well, dentists, if you see, dentistry is very difficult. It's not easy to be a dentist, mentally and physically. The skill, the sets that you need, you really have to also be calm. Sometimes when we are injecting our patients, our heartbeat might be like 120, but we pretend that we are very calm.
Right.
And the equipments, you won't believe, like if I show you a small equipment, you may even actually get a car, with that money. So it's basically because we are supplied with equipments which are very expensive, and the materials, there's so many things, So I think that is why you have to take care of your teeth before they get rotten. Just brush and floss, and then it's not expensive. Just the cleaning, it's not expensive. If you neglect, negligence is expensive. I always tell my patients.
So if you don't buy a 100 rupees brush today, you might end up spending 100,000 tomorrow.
Yes, even 20 rupees brush is okay. But again, the truth is you have to know how to brush. And I would say in my 18 years of practice, 99% of the patients, they brush in the wrong way. They brush, but sometimes the way they are brushing is more harmful, or the way they brush is not correct. And in Nepal, many of us don't even floss. Like, brush can actually reach only 60% of the areas. Remaining 40% of your mouth, they're accessible only to floss and interdental brush, which 99% of the patients don't do it.
What is interdental brush?
Interdental brush is that tiny tool, it's kind of a miniature brush which you put in between the teeth. Okay. Because you have to disturb the bacteria. If you don't disturb the bacteria, they form a biofilm which becomes harmful, pathogenic. So every day you have to make sure that you clean in between the teeth also, because these are the areas which are most vulnerable. You have cavities. Most of our patients, when they come for a regular checkup, they have cavities in between teeth. And if you see gum disease, in between teeth. So that's the area where bacteria can really hide and cause the damage. So if you brush and floss or use interdental brush, depending on what condition your teeth are, that's the best. Then you save all the money.
Floss is cheaper, right?
Yeah, floss is cheaper, but then again the technique. A lot of patients just floss like up and down, but that's not correct. You have to really master the art.
Okay, I'll make another video with you how to brush, right?
That
But then, other than that, you've been in this field since a very long time. You've been in this field before I was born.
Really? Okay.
I'm 98 born.
98?
You didn't know about that, right?
Okay, I'm feeling young now.
Okay. So, what's the most common disease that you've seen in patients? Is it because of not brushing or?
Bleeding gums, I would say. Most of the times patients have bleeding gums, but they don't really realize it. And bleeding gums usually is detected when you use floss or an interdental brush again. So if you're not using these tools, you will never know that your gums are bleeding. So that is the first thing, and they say it's even more common than the common cold, bleeding gums. And it's not normal. Bleeding gums, a lot of patients say, alikati brush tere garyo hola, tesele bleed bhayo. But that's not true. Bleeding gums means there is a problem, there is an infection under your teeth or in the gums.
But sometimes if a person flosses too hard, then can bleeding gums happen?
Not really, because if your gum condition is inflamed, if you have a disease, that's when the gums bleed. So even like having apple when your gums are inflamed can cause bleeding. So most of the patients feel like, they brush a little too hard or floss a little too hard, but that's not correct. It should not bleed. Like for example, you have like your hand and it should not bleed when you touch. Similarly, your gums, if they are healthy, you touch, you floss, you brush, it should not bleed at all.
Makes
and
sense.
So many times we see pus coming out of the gums, which of course you will not really see. It's hard to detect. And then I tell my patients, if you see a little bit of wound in your hand, in your body, and you see persistent pus like draining for 2-3 months, will you not take this seriously? But of course, in the gums, they don't see, they don't feel pain. And there is this connection between oral health and systemic health. If you see diabetes and oral health, it's a double-ended sword. Yes. Because of diabetes, you are more susceptible to gum disease. But because of gum disease, it becomes very difficult to control diabetes. Okay. And
bleeding doesn't stop, right?
Yeah, it's very difficult to stop bleeding. Like, mouth is a part of your body. But just because you go to the dentist to treat your mouth, you tend to segregate dental health and systemic health. I always tell my patients, when you have bleeding gums, what does that mean? The bacteria, they enter your bloodstream. And that bloodstream is connected to your kidneys, your hearts, really. So if you have disease, mouth is the window to your system, your whole body. Yeah, it's a mirror of your, it reflects, how well or how healthy you are.
Don't you feel disgusted when you see pus coming out of someone's mouth? Or I don't feel disgusted.
No, that's our bread and butter. But you feel good when such patients actually start taking care of their oral hygiene, and then you see in few months' time, you see good, healthy, pink, pristine gingiva and the gums. Yeah, that's when you feel good. Seriously.
Okay. So, don't forget your coffee though.
I know, what question is coming next?
Okay. So, there are so many researches on the internet. For example, on the other day I read a research in which they said staying fat is healthy because you can store that energy for, for some XYZ use. And then people neglected it immediately. But that research was very obvious that it's completely false. Who likes to stay fat, or it's not healthy. But then there are so many researches on the internet. For example, if you show me 10 medical researches, I won't be able to differentiate which one is the correct one or which one is the false one. So what would you recommend? What's the best course of action for a layman to differentiate these researches?
See, as medical professionals, we always have to see where the research or the article is published. If it's a journal which has been peer reviewed, which means somebody has already done that quality assessment, we have to see who is sponsoring the study. For example, there are 2 brands of toothpaste, and one is done by A and the other one is done by B. Yeah, so they might have conflicting results. So you also have to see the sponsors, the conflict of interest, and a peer-reviewed journal is always, what we look for. For a layman, I would say go to a website which is trusted. For example, you cannot just go to somebody's blog and read. Like if you say, okay, my tooth is hurting, there could be so many things to it. So you will be completely misled. And sometimes when we get these kind of patients, the Googling patients who have Googled like the whole day, and they come up with their diagnosis and their treatment plan, that's very difficult for us to...
You don't really like those people, do you?
No, of course not. Because little knowledge is dangerous. You've just read... Of course, for me also, if I have pain in my leg and if I Google, I'll be completely misled. So I have to trust my doctor. So make sure that you go to a person, a medical professional who is not a quack, who has had good experience. I would always say like where there is a team of doctors. Okay. So for me, I would say don't just trust, the things that you see
on the internet.
Yeah, internet, Facebook, social media.
But then there are so many people who've uploaded, the traditional medicines and other things, which seem
It has to be well researched. For example, a toothpaste is launched and it does not have a fluoride. Okay, now it may be a very very popular toothpaste, but then again you have to see, just because it's like traditional or somebody has given that brand name, you cannot trust it. You have to see something which has been researched, well researched.
Okay, so you are trying to say that it should be well researched? Yes,
not just because it appears on the TV. Like for example, I still remember during childhood, there was a Vico Vajradant. You were not born that time.
I've seen that.
Okay, and then they used to have sugar cane. Now, those things are really bad for teeth.
Really?
Churpi is really, really bad for teeth. And I know some people, they say like churpi is good for teeth just because maybe it has calcium. No. So, a lot of things, just because it appears on the TV or nowadays Facebook, it's not true.
But sugar cane was used to, as a toothpaste or something.
Miswork. No, but of course, something hard. You should not use your teeth as tools.
Okay.
You should buy the tools.
Okay.
Yeah, you should not abuse your teeth, I would say.
Abuse your teeth.
Yeah, open the beer bottle. Those are not.
So another question. I know I didn't tell you about this.
Okay.
How do you differentiate a quack and a doctor? Because how do you differentiate?
You have to just see the NMC, the certificate.
Okay, I can see the NMC certificate. I know that's the perfect way of verification. But then again, you go to a chartered accountant, for example, you know nothing about accountancy. Alright? You go to a chartered accountant, he says these financial jargons. And then how do you, and then for you it's very difficult to, find out whether he's an authentic chartered accountant or just a random practitioner. Not a legitimate practitioner. So for me, similarly, for when I go to a clinic, it might be small, but it might be of a professional doctor.
Yeah, absolutely.
And I might go to a quack and he might have a big clinic, but he is still a quack.
You mean a medical doctor who is not doing proper, who's not doing ethical work?
Yes.
Oh. Well, I don't have an answer to that, but of course, first of all, you have to see that you go to a person with NMC number. At least you know that he's a doctor and not just wearing a white coat.
Yes, that's very important.
Okay, that's very important. But then again, after that, you can't just trust the doctors. Of course, you have to do your homework and you have to... I think the best is you talk to the doctor and you try to see how he has treated the other cases, you can always take second opinion.
But I've seen this one thing amongst professionals, not of a certain field, but as a whole. People who are not who are not professional, I mean, they tend to complicate stuff. That's what I've seen.
If you don't know the answer, you confuse. Yeah.
If
you can't convince them, then confuse.
Yes, exactly. So can that be a way to verify whether the doctor is a quack or a professional?
Very difficult to say. I mean, we've had patients who go to the doctors and yet they suffer because probably that doctor is not skilled enough, and that is why nowadays there is a system coming up which says like you have to update yourselves.
Okay.
Just because you got a degree in 1980s, it does not make you a good doctor.
You got it in 90s though.
Yes. That is why I invest my time, my money, and that could be an answer to your question why dentists are expensive, because we have to update ourselves paying so much. We go for a certain course and that we pay in lakhs.
Oh yes, yes.
Really, I mean, forget the travels and all that. The courses are so expensive, and we learn and we come and we buy the equipment and then we do to our patients. I mean, it is expensive because it has to be, not because randomly it's just expensive.
I can see that by looking at your desk. So I watched Munna Bhai a lot of years ago. So in that there's this one scene where...
Were you in diapers that time?
Most probably. But then after I grew up, I watched it again. And then there was this scene where the dean asks the student if you would feel for the student, if you would feel for the patient.
Patients.
And then he says no. What's your thought about that?
That's absolutely wrong.
Really?
I mean, you have to feel for the patient. You don't just treat the disease. You have to treat the patient with the disease if you want to be successful and if you want more referrals. To differentiate whether you're a good doctor or not, it just depends not on the... not on anything but the kind of referrals you are getting. If your patients are happy, they're going to send more patients back, and that's like word of mouth. Okay, am I deviating from the topic? You said like you have to feel for the patient. Of course you have to feel for the patients. There may be some patients who cannot afford certain treatment. So what do? Maybe there's an alternative. I mean, you have to talk to them. You have to... Emotional dentists, nowadays they say like they are the most successful. You have to connect emotionally also. You can't just take a patient like a case and finish it off. You may be doing good job, but you have to connect to your patients emotionally. That's very, very important to be successful, I feel. You have to feel for your patients.
Okay. You said about word of mouth.
Yes.
That's a good marketing strategy. That's a great way to review your progress. Okay. It doesn't matter. Don't worry. But then again, for example, when I am in the gym, I've had injuries in my knees so many times, like when I'm wrestling, right? So I've got injuries on my muscles, my tendons, my bones. And then there are these newbies who come to the gym and then they have the same injuries, and I know how it feels. And whenever I go and try to apply first aid, I mean, that reaction comes up, and then I feel that pain too, and it becomes difficult for me to heal them. So are you trying to say that you have to feel for the patient in that way?
No, I think communication helps a lot here. Now, you have to communicate with your patients, and of course, like in any other field, even in dentistry, we have a lot of complications, we have a lot of failures. If somebody says, oh, I've never had failures, that's not true. I've had a lot of failures. I've cried so many times, because I failed in my cases. But then again, you get up and, you again update or you change your method, those things. Now, if you have communicated with your patients, I feel even if you have a failure, they will understand it. That's like, I mean, I have seen over the years, I still remember a case where I had disastrous results. And I actually cried after doing that case.
I hope you didn't kill the patient.
No, but then of course, like I think I had communicated well and I had done a good consultation. When you do a procedure, you have to tell, you have to be very honest to your patients. If you're doing something for the first time, I know it sounds funny, but you have to tell your patients. I have done that, and somehow you have to get to that level. So this patient, after the failure, we had to redo the whole thing, and few months later she went to the US and she got me a gift. And that was like the best gift ever in my life.
You guys get a lot of gifts. I mean, you go to a chartered accountant never gets
No,
gifts.
that's because we spend enough time with our patients. Like we see a dentist, they spend a lot of time with the patients, and sometimes the patients are the ones who tell you, doctor, you actually, you put on weight, or your hair color is looking nice.
Okay.
I mean, seriously, I have these patients who tell me that, and I really take it.
Do they do that for a discount?
No, no, because see, there's some patients you have seen for such a long time. They become part of your family.
Okay.
That trust that you build up is so much of more value than anything.
Okay.
So yeah, you do get gifts. I mean, there are patients who cook something for you specially, or they get something for you. I mean, that's nice. But I think again, there, like, you have to have a good rapport
and good hands.
Yeah, the skills, yes. And sometimes you may be in a situation where you are not confident enough, then you must refer it out.
Okay.
Because, then the patient really knows that, okay, this doctor is not doing it, but at least sending me to another doctor who knows about it. And sometimes you may lose a patient like that, but at least you know that you have done for the benefit of the patient.
That's true. That's true. Anything you want to ask me? Oh.
So when was your last dental visit?
Alright, this is it for this episode. So I guess I don't even remember my last dental visit because from a professional doctor, I got it 11
Professional doctor? Do you go to a quack?
No,
Don't tell me.
No,
Okay.
no. So
I'm sure you're going to edit this part.
So 11 years ago, when I was a kid, that was the last time I had gone to a professional dentist. Now, as you know, my sister is studying dentistry, and they need patients for their degree, right? So I've been there, and then the professors over there have looked into my teeth. So if you consider that dental checkup, then yes, I'd gone over there in the previous 6 months.
Okay.
But if you
so what did they say? Oh, Sudev, you have very good set of teeth, or you need to brush
the brushing part every dentist says. I'm not going to.
No, but that's not enough. You have to actually practice with your dentist.
Yes, that's true. But they never say about flossing. They never say about flossing.
If you see, we really emphasize, and one thing, if I need to vouch in my profession, I would say people who floss and using the dental brush have the best set of teeth, and they need to visit their dentist to the least amount. So when you go out of this clinic, I'm going to gift you a pack of floss.
Okay. So
I mean, you go to the gym every day, right? Why do you go to the gym every day?
Become better at what I do. To become better at what I do, and for physical fitness.
Is it only for physical fitness, to look good?
One is to look good, the other is to achieve my goals, to become better at what I do.
Okay.
And that's martial arts. And I've learned a lot when I go to the gym. I've learned a lot about the body, not as much as you know, but a bit more than the layman knows. So it's more informative, it's more friendly. I've got a lot of friends over there, and that's the whole gist of it. I like going over there.
So it's the same thing for the dentist. Okay, you have to have your goals, oral health goals. You cannot neglect this part of the body. It's very important. We always say they're more precious than diamonds, because if you don't have teeth, you don't have quality of life. Even if you live for 100 years and you're not able to enjoy food, what is it for, right? So your quality of life really depends on how you take care of your teeth. So like your gym, I would say visiting your dentist or investing time, but of course you have to know how to do it. Like you consult the gym experts, you have to also consult the dental experts. I mean, you cannot do without it.
Come to Ora Care. Okay, I get your point. So you've been to a lot of countries.
Yes.
Which country, according to you, is the best country to go to?
You mean for?
I mean, traveling.
I would say Nepal.
Oh.
Like I've not traveled so much internally, but yes, I've been to Lukla, Namche, a few other places, and I feel the kind of that
friendliness.
Not just friendliness. I don't know. It's so beautiful. I remember going to Manang with my friends, and there, that peace that you don't get even in Switzerland. I mean, it's I don't know, somehow I feel Nepal is the best.
Oh, right. So you already have your best ticket with you. Okay, so let's send it over here.
Okay.
So guys, this is it for this episode of my podcast series. Try to follow Dr. Rita Singh on Instagram. You've got a page as well, right?
Of course, but you need to be a lot of my friends, they say, oh, why do you post such pictures, bloody pictures? And I say, if you are selling cars, you post your cars. If you're selling like other products, so it's it's the same thing for me. So if you are following you better have a good heart. I mean, a strong heart.
Okay, so follow her, follow me, and let me know if you like this video. And this is it for this video. I'll see you soon in the next one. Goodbye.
Goodbye.